Hi, welcome to our new Clinimetrix version, and today we're just going to have a quick look at the new tool called Patient Cohort Analysis. So this tool allows us to dive in and select and exclude certain patient cohorts based on test name, observation, results, age, billing type, medication provided, even medication strength, patient status, attendance rates, locations, so on, so on, so on. And in the past, using this kind of tool or getting these kind of outputs has been very complicated within Clinimetrix, and it required you to move around between sheets. That's completely changed now. It is much faster with a complete record of all the activities that you're actually looking to achieve. So I'm going to go through a quick demo right now. So we'll start with test name, and we'll do the usual diabetes test. So we're going to go HbA1c, and we'll select that. Now we're going to look for result value of greater than 7.4, so by diagnosis, a diabetic. And what you will see is that we're looking at all time here, so I'm also going to set a specific period, it'll be 2024. So in the last 12 months, there have been 198 patients who have had a diagnosis through pathology that they have diabetes. So I've got that cohort, and I just simply set that cohort by clicking the blue button, set patient cohort, and as you can see on the right hand side, it describes exactly what we've done. So now I've got 198 patients who have diabetes. If I want to find out how many of those patients actually have not had a 721 in the last 12 months, I've still got the same grouping. So now I've got those 198 patients selected. Now I've selected 721 as the MBS item. I'm going to again select 2024, and what I can see is down here is only 57 patients who had a HbA1c that was in excess of 7.4 in the last 12 months. Only 57 of those patients have actually had a 721 in that period. So what we've done in the past is had to leave this sheet, hold the patient base and bounce around. Today, we simply hit exclude so that we get the list of patients who have not had a 721 in that period of time. So I'm going to click the exclude button. You'll see the whole process run. And now what I've got on the right hand side is the indications of what we've done. So I selected calendar year 2024, test name of HbA1c and GSP, result value greater than 7.4, and I've then excluded those patients who have had a 721 in the last 12 months as well. That leaves me with 141 patients and 140 who've had an appointment in that period of time. So now I can actually just right click and extract that from this page. Don't have to do anything else. To get my data set and start communicating with those patients straight away. Now, of course, I can dive in even more. I can do things like show me current patient status. Have they attended 3 times in the last 2 years? So now I've knocked that down to 133 from 141. Are they on any medications? And I can select any medication I choose. So, I mean, not for any reason, but just ACE inhibitors. How many? 29 of them obviously have blood pressure problems as well. I can go by current patient age group, so I could go with greater than 74 and just see how many of them are probably due for a 707 as well. There's 48 of those. So right now, I've started with my initial cohort of diabetics. I've excluded those patients who've had a 721, so no one's had a 721. I've got a list of patients now who have attended 3 times or more in the last 2 years. And I've narrowed that down further to show me the patients who are aged 75 and over, set patient cohort based on these tools up the top. I now have 3 layers. So now I've got 48 patients who are 75 or older, diagnosed with diabetes, haven't had a 721 in the last 12 months. It's a really, really powerful tool, a really, really quick way of getting data out. Every metric we can possibly think of is in here, all your observations, all your patient history and conditions and diagnoses are in here. Of course, medications we've discussed, usual doctor, location, and of course, who they've actually seen. All available in the brand new patient cohort analysis. Extremely powerful tool. No limit to the number of layers you can create. So you can have 2, 3, 4, 5, 6 comorbidities, or you can bounce in and out of observations, pathology, diagnosis, and NBS items billed for a single doctor or multiple doctors with medications if you wish. All in the one sheet, all extremely simply to get data out of. And as you do it, you can also check the results as you're moving along. So there's lots and lots of power in this tool, extremely clever, extremely detailed results, something unique to Clinimetrix that no one else can do right now. Talk to us if you're interested in finding out more.